In this video, we're going to review a PT visit note on Kinnser. So the first thing when you log into Kinnser, you're going to want to make sure you go to your hotbox, which I have done here, and you'll see the tasks that have been assigned for you for the day. So as you notice, I need to do a PT visit note for Allison Plummer today. If you choose to go tomorrow and it's still within the frequency, so it's okay, you can switch the date there. But we're going to go today, the 22nd. So we're going to go ahead and click on our PT visit, or you can click on the patient's name and it will bring this up. Again, you're going to confirm patient's identity, type in the time that you went. Some of this information is already typed in because I typed it in, but some of it's carried over. I'll try to tell you which is which, and then your visit date, and you can ignore the documentation and travel time. If you're going to want to make sure that this says whether it was performed by a PT or a PTA, so change that if you're a PTA, and it may change that automatically for you, but please check it to make sure. This carried over from my evaluation, the health status. So if things have changed, for example, the patient is no longer requiring assistance for all activities, but some of these other things are still applicable, make sure you check that. But still, always make sure you're saying whether the patient is homebound or not. So we'll go ahead and type in the patient's vitals and the way that we took it, because that will be important. They'll send it back to you. And the other thing that you'll note that I talked about in the evaluation video, for those of you that watched it, is that you'll have the opportunity to type in how the vitals changed during your treatment, and then, which is a change from our previous system in Devero. You'll also be able to talk easily whether they were on oxygen, which was harder to do. And then, for example, if you take them this is when you took them, during, prior, or post, or if they made any changes, like I said here, or any comments about them. The treatment plan stuff should carry over from previous. This carryover is a little weird because I didn't save it correctly or sign the note, but this will be pre-populated for you. This is where you'll have to type your subjective information, such as patient was complaining of knee pain, etc., whether or not they did their exercises, all those sorts of things. Again, this information carried over their pain, so this is where you'll have the opportunity to say what is hurting them pre-therapy and also post-therapy, so if it got better or worse with your interventions. This is a knee patient, so my exercises actually increased her pain. She also was having some back pain, so you can go ahead and select other, type in the section. Her back pain was 4 out of 10, but after our treatment and soft tissue massage, that improved, for example. Not that you would be doing that on a knee necessarily. This information, the way I saved it, didn't carry over, but all of this information will be filled out, whatever was typed in the evaluation. So the only thing you'll have to do is make your changes. So this patient's pre-surgical knee flexion was at 75. So today, after our interventions, they were at 90, still lacking 5 degrees of extension. So I went ahead and updated that. And then how is their range of motion affecting their function? So make sure that you update that, because this information carried over. So if it's no longer affecting them with dressing, they can get dressed without ease. Make sure that you're changing that and that we're not just letting that information stay from time to time. This is where we'll also have an opportunity to change their assistance level. If they're no longer min assist for supine to sit, then we'll go ahead and update that they can now get in and out of bed independently with no assistive device. And did we provide any training specific to that? So did we work on, for example, worked on log rolling in and out of bed due to back pain? So then again, you can fill in the reason or impact for function, or how the impact of the treatment on their function. So this is where you could type that patient was able to get in and out of bed easier after log roll bed mobility training, or that's why they could now do independence instead of min assist. Same thing with transfer training, it's pretty straightforward, and you can just make sure to update this with the assistive device. You can also write down any training that you provided and the outcome of that. So for example, the patient at eval was walking 150 feet with contact guard assist, front wheel walking. So today we did pre-gait weight shifting, and we worked on heel strike while ambulating with walker, focused on walking endurance, and trained on steps leaving the home. And then you're going to type in the impact. So what did their, oh, sorry, so the steps leaving the home we would have put here. So you guys would have figured that out, obviously. So what impact did that have? So with our pre-gait weight shifting, the patient had improved weight acceptance on right lower extremity and improved left lower extremity step length. So their gait was no longer as antalgic, however you want to write that. So then you'll move on. The same thing with wheelchair. If you're working on that, you have an opportunity to update their balance section, and if you require any cueing. And then here's where you can do follow-up testing. So if we repeated the tug today, last time we repeated it, they were at 23 seconds. Today they increased that to decreased that to 18 seconds. So what was our test result interpretation? So patient improved tug, working towards reduced fall risk and improved functional mobility, something along those lines of the interpretation of the test that we performed today. This is where you'll have an opportunity to type in specific exercises. Obviously up here you typed in some specific training interventions towards their working towards improved independence. These are your direct like strengthening interventions or balance. So for example, I typed in long arc quad. The patient actively participated. They were sitting. You could type in other if you were in a different position, and have an opportunity to type in if there was any resistance. And then it only says reps, so I just put 3 times 10. It doesn't give you a number of sets, so you could have put 30, 3 times 10, however you want to put that. And then how did you help? I supervised, I provided feedback and verbal cueing for correct form. You can type in up to 8 different exercises. If you needed to do more, I'm sure you could using these other spaces for the specific impairments. And then again, you're going to type in how the patient reacted to that. So did it get easier, harder? Did they participate well? Did they stop after 2 sets due to pain, etc.? That's what you'll type here in this box. So this is going to be the most important part, updating and progress towards goals. So again, you'll see a goal that I had put in earlier, and so let's go ahead and go to the goals and interventions. Again, it saved it for me. And so let's say we wanted to update this range of motion goal. So because we worked on range of motion today. So we're going to go ahead and expand that. And these were the 2 interventions that I put in specific to this goal. So physical therapy to utilize passive range of motion, stretching, joint mob, soft tissue massage to right knee and quad, and hip to improve right knee functional range of motion. So today we want to say that we performed that today. So we'll go ahead and click on performed, and I already did this, that's why it's populated like this. This box would normally be green, and I click on that, and then you'll type in who you performed that on, and today it was only the patient, not the caregiver. They need this ongoing, so I'm going to say that they need reinforcement, and that their current range of motion today improved from, I think it said 5 on that other screen, so we'll stay consistent, 5 to 90 degrees of flexion. and then you can go ahead and submit that. You can go and look back the different times you provided that performed that intervention. So I performed that intervention twice already, the education, and they both show up here. So let's say we wanted to work on this gait goal. So you'd click here, and this is where you have the opportunity to then perform it. This is what I meant by the green box. So today we provided gait training. We talked about that earlier. So let's go ahead and say we performed gait training with the patient. They need ongoing reinforcement, and what evaluation happened with that. So we already talked about patient improving gait mechanics and walking further functional distances with less assistance. Patient still requires contact guard assist to ambulate safely in their home with walker. And then we'll submit that. And you could put a specific distance in there, but then you'll see that it showed up as performed. So you can also go and look back at goals that have already been met, but you want to make sure that any goal you're working towards. So if you worked on tug or provided gait training or balance training that may help with the tug, we're going to want to make sure that we then go ahead and say we performed some of these interventions. So did we work on their balance program today? So that's where you'll fill that out. So for time's sake, I'll let you work on that later on your own, but after you update the goals, you're going to press return. It will take you back to this screen, and we'll scroll down, and this is where what we just updated will show up. A few things that I should have noted before, because some new people will be watching this video. If you go to this need help section and navigate, for time's sake I won't take you to that, but navigate to need help. I'll just show you real quick this one side. You need training. You can, on the left side, you can go to clinical training, the clinical training, and there'll be a section specific towards this PTG, progress towards goals, and it will be a 50-minute video showing you how to update this section if you need that help. Then you'll go to your plan, and this is where you'll update what you're going to do on your next visit and any discharge planning. So I typed in that we're going to do TheraX, education, fall prevention teaching, review their home exercise program, and provide gait and balance training. And then obviously your care coordination. So today I talked with the PTA because she's going to take over on this patient, and I talked with the skilled nurse about the plan of care and their functional status. These boxes down here, save will obviously save it. Submit only after you've signed it electronically, which you'll have to do each time. You won't use this approve button, only in the office. And then return is if they send the note back to you, you'll press return after you fix it. For electronic signature, each of you will have your own. It will prompt you when you first log in and first have to use it to create an electronic signature. I'm not going to sign it today because I am logged in under someone else. Don't mess with these other two boxes, just leave them how they are. One thing that I didn't say that I should have said at the very, very beginning is this is different than Devero, and it will not automatically save. So each time you'll have to scroll to the bottom and hit save, or if your cursor is in any free text box and you hit enter, it will save the page for you. So I do not want to see you guys losing your work that you've spent time on. It takes forever. Documentation is the hardest part already, and I don't want to see you lose your work. So write yourself a note, get in a habit of hitting enter after each box that you type in so you don't lose your work. If you have questions about this PT eval, or the PT visit, feel free to contact myself or Jeremy, or go to this needs help section first and see if you can find something that may answer your question. But as you get through this and start working on it, you'll figure it out quite intuitively on your own. It's not too difficult, but may take a little bit longer time than previously.